Welcome to Staying Connected, a podcast where I talk to people about their stories with VEDS, Marfan, Loeys-Dietz, and related vascular and aortic connective tissue conditions. The views, information, and opinions in this podcast are those of the individuals involved, and the information presented does not constitute medical or other professional advice or services. Welcome back. Today we're going to talk to Nancy Billon, who was diagnosed with VEDS with a combination of her medical history and a genetic test that revealed a variant of unknown significance on COL3A1. Before we get into the interview with Nancy, if you like this show and you want to help our communities raise awareness of VEDS, Marfan, and Loeys-Dietz, you can buy merch, including tote bags and t-shirts, from my Printify pop-up store. A link to the store is in the episode show notes. You can also support the show by joining my Patreon. It's a great way to support the podcast, and this show wouldn't be possible without the continued support of my subscribers there. If you have already been supporting the show, thank you. Thank you, thank you, thank you. Let's get into the interview. Hey, Nancy, thank you so much for joining the podcast to share your story with a VUS for Vascular Ehlers-Danlos Syndrome, or VEDS. Do you want to go ahead and introduce yourself for people who don't know you yet?
Oh, sure. I am Nancy Billon. I live in Arnold, Maryland, on the East Coast. I have 3 kids. They are 10, 9, and 6, so pretty busy with them. My background is I am a nurse, and done 15 years nursing. Just went back to work now that my kids are all in school and just keeping busy with them. Summer's here, so we're enjoying summer so far.
Yeah, wonderful. Summer. I love summer.
Yes.
Love summer. So how did this VUS come up? What was your, first off, maybe for people listening who don't know what a VUS is, do you want to describe it in your own words?
Sure. Basically, I learned what a VUS is through me, unfortunately. Is that it's a variant of unknown significance. And basically what's been told to me is that basically there's not enough people that have the same exact variant as I do that to be able to classify it one way or another. So whether it's pathogenic, probable pathogenic, or benign, but there's just not enough people that have been. When I first got diagnosed, I was the only one on the list with the variant. So they didn't obviously know how to classify it, but they did take a look at my background and then move from there. But basically it's been explained to me that we're just basically in a waiting game for now to find out what it gets classified as. However, with mine, I have been given the VEDS diagnosis based on my background and history. And basically what told me is kind of keep myself and my children safe, basically by having the diagnosis, because they feel strongly that it is a pathogenic variant. Yeah.
So how did this VUS come up? How did you land with this?
So basically everything kind of started, it was 2017 after I had my last child, Nora. In 2017, July, I had her. Nothing really stood out. I had a pretty simple delivery of her. And then, unfortunately, about a week later, I was at home. Everything was great. I had my mom staying with me. She was getting ready to leave and go back home to New Jersey after visiting. Things were going fine. And then all of a sudden, I just didn't feel right. And I went into the bathroom and basically I collapsed on the floor of the bathroom and I knew something just wasn't right. I couldn't get up. I had this excruciating pain in my abdomen. I just immediately at that point, I knew something was not right. Obviously my husband and my mom kind of came upstairs and, they ended up calling an ambulance. I ended up going to our local hospital here and had a CAT scan done. And they said, oh, definitely unusual. Something's going on. And then I was basically at the hospital for 3 days before they realized that I was basically was bleeding into my abdomen. Something was going on. My blood counts were dropping. I am needing blood transfusions, having to go for surgery. And basically when they had done the surgery, they found that my uterus was bleeding and that they basically had a tear in the uterus on the inside, which again was told very unusual. But they had repaired it and got all the blood out of my abdomen, and I had transfusions to kind of bring my levels back up. And so I said it was very unusual, not something that they have ever seen before. I after that point, I had woken up from surgery. I definitely felt a lot better, but then I had some kind of unusual symptoms. Half of my tongue was numb. I'm like, that's kind of weird. I went to go eat and I'm like, that's odd. Oh, I definitely have a headache. And I went home and I continued to have a headache. Then I started to notice that the headache was really only on one side of my head, only on the left side. And I'm like, that's unusual. So called the doctor that was on call back that I had spoken to previously. He was like, yeah, it's probably just from the anesthesia. Here's some meds we'll call in for you. Just waited and see. Again, the headache just kept getting worse. I noticed too, like my vision was starting to kind of be blurry a little bit when I was looking at certain patterns and things. Something just didn't seem right. So we went basically it was a full week after I had that surgery and had to continue in the symptoms and they were getting worse. Unfortunately, my husband is a primary care doctor. So he started talking to like some of his other providers in the office and like just talking and decided to call a radiologist and kind of run it by him. And he's like, she probably should have some imaging done. And, she probably have her come in. We'll have her come in today, And I thought it was overkill going in for an MRI for a headache. And I'm like, oh, it probably was the anesthesia. It makes sense, And
how long was this after you were discharged? Or did it start in the hospital and then you were discharged anyway?
Yes. And that was like a whole week later. So this is I have a newborn still. She's only 2 weeks old at this point. So we were 1 week out and I had the surgery. I was in the hospital for a couple of days and then a whole week later. So she might have only been at 2.5 weeks after I gave birth, 2.5 week old. Breastfeeding, have a newborn, it was crazy. Then they're like just giving me all these different narcotics and things like this, trying to get for the headache, and I didn't want to take it because I was breastfeeding, and it was messy. So I ended up going in for the MRI, and I went in, and I remember too, they gave me these headphones. I've never it's funny, as a nurse too, I've always had patients complaining about the MRIs, the banging, the thumping, and I'm like, it can't be that bad. It's just And I'm like, oh my gosh, especially when I had a headache and they were playing this loud music. And I remember this music being so loud, it seemed like such overkill. And then I was driving home and the radiologist called me and said, can you turn around and come back? It probably is nothing, but we want to just go ahead and just make sure that nothing, it was just from you moving or something in their MRI. I'm like, okay, I have my newborn at home still, I need to feed her, okay, turn around and go back, and, I end up getting I'm just doing and repeating with contrast this time. The first time was without and this time was with contrast. So they repeated it, and okay, just waiting in the waiting room. And I was out there for a very long time, waiting in the waiting room. And I'm like, this is kind of odd. I actually being a nurse, I had worked, in radiology department for a while at a breast center. So I'm like, okay, let's wait and see, So then, the radiologist wants to talk to you. And I'm like, okay, that's not a good necessarily good thing in the radiology world. So I go back and and this is awesome. My colleague, he owns the practice and, we have never seen this before. And I'm like, okay, basically they said it was a, vertebral artery dissection I had. And they said, we're very concerned. We just talked to a neurologist, about whether or not we should send you directly to the ER or what to do, So what we're going to do is, you need to go home immediately and take an aspirin. We're concerned that you literally this could kill you basically, and that you need to be really careful. And we need to come back to this building to see the neurologist at 8 a.m. He's going to be here to meet you. And so, of course, I'm like, I don't even know what that is. I've never even heard of it. And they're trying to explain to me and they're showing me on the imaging, my artery and how it's basically flapping. There's a huge clot on it. And,
that is so scary.
Yeah. So I'm like, I have 3 young kids at home. At that time, I only had a 4-year-old, a 2-year-old and a newborn, at home. And, it was obviously worst case scenario, left in tears, So then I came back the next day and I met with the neurologist and, I was there for hours with him, with my 3 kids, my husband, and a baby breastfeeding, it was quite the scene. But, and he said, in his practice, he was an older neurologist and he said that he's only ever seen it one other time. And, he's like, we sat there for the longest time, looking, he researched who to best go see after him. He's like, I'm not the expert. I want you to go see somebody else. He's like, I'm very concerned for you. We want to make sure you're in the right meds too. And So, obviously at that point, like it just became about the dissection and obviously like I was very scared, because he was also, there's a good chance you could die from this. Here's the signs of stroke. Please be careful. Like, you need to watch this. You need to watch that. There's a good chance that you might not make it, and of course, like I'm sitting there with my 3 kids. Like this is the worst day of my life, basically,
Yeah. Yeah, for sure.
So I'm just sitting there and I'm like, okay, he's like, okay, I'm going to try to reach this doctor. He would end up finding like a specialist at Hopkins that was see like young, he's like, let's target this physician because he sees young stroke survivors. He would have seen dissections. You know what I mean? And this is who you need to see. You know what I mean? You call, I'll call, and, I was at that neurologist for hours. I don't know what he did with other patients. Like, I don't know what happened that day. Like, I literally was there for hours with this, doctor, like, super. Like, I've met some superior doctors in the realm of this, but he also is like great because he was like, I'm not the expert in this. You need to go see somebody who is, and like, so I did, and obviously as soon as you go home, so you start Googling and looking at things and dissections and like, it popped up to me like the vascular Ehlers-Danlos. It was like a hit repeatedly, when in searching. And, I'm like, like this is interesting. Like I am very flexible. I've always been able to do splits my whole life. I could turn my whole feet like straight all the way around the other direction. I'm like, I can pass the test, the thumb test, I was like, okay. I also had, this hip dysplasia when I was a baby, I was born with hip dysplasia. And I'm like, there's a lot of times in my life I look back, I'm like, a lot of times I was passing out, and nobody knew why, and different things, and, I looked back too, like I had a previous abdominal surgery, and I ended up hospitalized after that. And like, now that I look back, I'm like, something was happening, I was bleeding my abdomen, no doubt in my mind, like I've had abnormal CAT scans after it. Like, now I know, like, so I started looking at this. So we ended up going to see the Hopkins specialist after like begged and pleaded for an appointment, basically. Because the medicine was like, oh no, it's 6-month wait.
That
and
wait
like,
is terrible. Like the wait to see these people can be so awful. Yeah.
Yes, I'm like, I have a newborn. They put me on Coumadin. I don't know what it's supposed to be. So I ended up going to see him. He was a wonderful doctor, but I asked him. I said, should I be worried that I have like one of the connective tissue disorders? Like I saw this vascular Ehlers-Danlos, like, you know what I mean? Like I definitely, like if some of the things are popping up and then the dissection, and then also the uterus being an issue, and he's like, oh no, pregnancy is such a hard on the body. I'm sure it's just pregnancy. It's a one-off thing. Don't worry about it. Kind of calm me down some, and I'm like, okay, like it still kind of sat in my mind a little bit, that I was like, okay, and obviously it's a rare thing. And I'm like, it still just never really made a lot of sense, but like I was barely holding it together at the time, to be honest with you. I mean, the kids and like being told you might die. And, it was terrible time, to go through all that. And like it just being so out of nowhere, because everything was fine until it wasn't.
Yeah. Was this still 2017? Did this all happen in 2017?
Yeah.
Wow. Okay.
Yeah. Yeah. So like, it was like, it all hit like out of nowhere. So then I basically was able to eventually just like kind of pick up the pieces and like move on. Eventually like I was on blood thinners for the longest time, and, they never got therapeutic. I just was walking around like it was ended up being so bad. They had to just take me off the blood thinners because my body I was bleeding too much, basically. Like I just wasn't tolerating them somehow, nobody knew why. And they ended up just taking me off them because I didn't heal enough. There was like still like some scar tissue type thing in my, where the dissection was, but it did essentially heal, and the clot obviously dissolved. That was like the big concern on the.
So they didn't have to do surgery on that. They just treated it with blood thinners.
Yeah. And then waited for it to heal, and I had to go back for repeated scans. And so pretty much like everything had to settle for a while. I still was supposed to get like yearly scans. So to check it to make sure everything was okay. But my son started to kind of have like some neurological symptoms. He had a diagnosis of autism, but like he had other things that were popping up. They're like, I don't think that's autism related. His tone, the way he's posturing his fingers, some things is like a little bit abnormal. So they end up referring us to neurogenetics for him.
And how long after 2017 did things start popping up for him?
It was, It would have been probably 2018 or 19. So it was like a year or two later.
So really everything you just tried to calm it. Like, forget about the vascular EDS.
And like nothing came up from that. Like, I was like, okay, like, and like the Hopkins doctor was very good. Like he calmed me down a lot. He explained a lot about the dissection and like, like talked me off a ledge basically because like I was obviously devastated over that, at the time. So like I was able to kind of move on. So life is busy, you move on. And like, if somebody tells you not to worry about it, you're not going to worry about it anymore kind of thing sometimes. So basically my son had an appointment with neurogenetics. So we basically had to wait a whole year to get in there. And it was just like our local like children's hospital around here, Children's National in DC. And, you have to do all that paperwork beforehand, like ask you all your history, and I'm writing it all down, everybody's history and my whole history. And, we get in to see them and we are there and, the doctor walks in and I'm there with just my son, Joseph at the time. And she walks in and starts immediately like grabbing my son and like just kind of like talking to me, introduce yourself. That she immediately starts kind of bending his fingers back and kind of like looking at his arms and how they're bending as she's talking to me. And then, pretty much like right after her introduction, she says, okay, she's like, I looked at everything so far and we're going to get to Joseph. But like first thing I need to ask is like, have you ever had genetic testing yourself? And I said, no. She says, so have you ever heard of like vascular Ehlers-Danlos or any like connective tissue disorders? And I said, yes. And she says, okay. She said, I think there's a good chance you have one based on what I'm looking at in your history. And, she's like, I need to make sure that like we get testing on you. And I want to do that today, and like, and then she basically, they gave me an appointment that day after my son's. And like, again, I was not there. I was there the entire day. I think it was like 8 hours I was there in genetics with them that day. So they ended up deciding just to test me for the connective tissue disorders. And then, my son, he had just had like a genetic panel done, based on his like neurologic symptoms and things like that. But she's like, he's definitely hypermobile in like a very unusual way, and she said, but if interesting about her, is that she was obviously understood the different EDS. She said she actually has one of the types of genetic EDS that is not VEDS herself, but she obviously knows a lot about it based from her own history, plus obviously being a geneticist too, a neurogeneticist. So,
how lucky is that? That is incredible.
Right now?
Yeah. I mean, the fact that that this doctor came in and was like, she's a neurogeneticist, right? You said, so she did not, like, that wasn't usually her scope, but she knew enough about it herself to recognize that something was going on and do something about it. Yeah.
Yes.
That's incredible.
And she's like, oh, you're smart. I'm sure you looked up, the dissection when you had it. And she's like, and your uterus, she's like, there's like, you hit so many of the points of it, you know what I mean? And she's like, oh, you have visible veins. Oh, you're hypermobile too, and like, you're hitting like all of the things that like, that makes me think that like, well, obviously we're going to do this and hope that nothing comes back and that like, we'll go from whatever, happens.
What did that feel like for you after that conversation?
For me, I guess, it's a little bit of relief because I had looked at it before and I was like, it was something that was on my mind, even though like I wasn't thinking about it, like I had, that like I had looked it up and I'm like, oh, that's really something like I could potentially have, and like, it's also too like that not ever having an answer. I'm like somebody who likes all the answers and likes to have all the information and like, and, having the section, like there was never an answer why, and like what happened necessarily. And like, so how do you know to prevent things either if you don't have that answers, So it was like a little bit like redeeming, but also like immediately, like as soon as like you start thinking about like this chance that you might have this, like I looked up now like 50-50 for my kid. And like, that's what's scary, is that like knowing that I went through things that could have taken my life and that like there's a chance that my kids could have the same disorder. And like that was something I guess that was the hardest part for me, I guess, was like thinking about my kids' involvement in it.
Yeah. Yeah.
So, it took about, I guess, 12 weeks or so. It's a few weeks for the results to come back, and mine came back first, and I got, it was the variant of unknown significance for the COL3A1. And the geneticist, I did like, I think a video conference call with her after, and she's like, all right, so we need to get you to see, she's like, I have a colleague I trained with and like know someone that's very knowledgeable at Hopkins. Like, here's a doctor I want you to see. I'm going to call him personally. And then I want you to call as well. And so I ended up going to see this specific doctor, and, I kind of started that, process, and he explained to me that, yes, I think you do have VEDS. Like, I think it is pathogenic, like as a geneticist, we can't just like put it down automatically that like you have VEDS unless it comes back as pathogenic. He said, however, we're going to definitely treat you as, I have 100% no doubt that like this is VEDS for you, and not like we're going to treat it as such. Here's what we're going to do. We're going to give you the control over that. We're going to give you like, put you on Losartan, and we're going to, my blood pressure was ready to like, I already ran a little low, but like we're going to put you on it anyways and see how far we can push it before you're symptomatic. We're going to do the yearly scans and, monitor you as such, and then like it came to like the big question for me, is like, now the kids, like, do we test them? What do we do? And the geneticist that I first had met, she wanted to test the kids, and she's like, yeah, like it just makes sense. Like, we have to like just figure it out, the other doctor that I saw, he said, I'm still like, I still go back and forth about like the discussions we had about it. Cause he said, once you can't undo it. Like once and that like there's no turning back. And then like life changes for them, where then what do you do? Like, are you doing yearly scans on your kids? Are you putting them on all the meds? Are you like restricting every little detail of their life and not letting them live a normal life?
This was the new doctor you were seeing at Johns Hopkins.
Yeah.
Okay.
Yeah. Yes. And I'm like, and he's like, that this is your burden to bear. Like you bear that burden and like keep it off of them, and like, he's like, but we'll test them if you really want to test them. But like, otherwise I say we wait until, they start to turn towards like puberty age when your oldest turn, and, go from there. And I'm like, I just don't know, and I never really felt like good about that. Cause if I'm like, how do I protect them if like if something happens and we have to go to the ER? Then we don't really have an answer. Like, and how do you put that into words? Like, where you go and, and should I restrict them? Should I be putting them in sports? Should I be doing, what do I do? And it didn't really sit well, and like, then you start to look at your kids in ways that, that you're trying to diagnose them yourself, like, look at the veins on their body, like, look at that vein, like, sticking out, and like, see the colors, and you start to really kind of question things, and like, you're doing the right thing. And time just kind of went on for like, we waited a few months, and then my son, again, like he just still had issues, like neurological issues. I kind of go back to during all this too, like after, like a few weeks after like my results came back from genetic testing, my son did as well for his genetic panel. And he also had a second, he had a micro deletion on his like 16th chromosome. So like he also got a diagnosis at the same time. So he had that as well. So
what condition is that associated with?
So he has, it doesn't even have a proper name, but it's called 16p11.2 deletion syndrome. Like that's the actual name of the disorder.
What does
like,
that
it's
mean?
Crazy, but it's basically on his 16th chromosome, there's a piece on the chromosome, very small, that is deleted. So he's missing a piece, and it causes several different issues. And a lot of things are we don't know what cause it, and is not completely mapped out on the 16th chromosome. So we don't even know what is actually deleted. But like certain things, like the autism they know is associated with it, low muscle tone, things like that. But then my son, after like we decided, okay, we're going to just think about the testing for the kids for now, and like just wait a minute and decide from there. Cause also too, like we kept being told to make sure you get life insurance on your kids before you get them tested. And like, I think every provider that we saw, and then other people as well, has said the same thing to us, and like, I honestly, I still, like, I couldn't wrap my head around that, honestly. And even like even process that and think about that, but the things that are said to you that you think you'll never hear in your lifetime, let alone have to worry about. But there you go. So my son, he started to have issues with blood pressure, and not just like a little bit. Like since they start like around 3 years old, I think they start testing kids for blood pressure. He's always had high blood pressure. And it was like, well, let's wait and see. It's probably because it's being done at the doctor's office. It's probably and then it just keeps getting higher and higher and higher. And eventually saw one of the different specialists for him. And they're like, yeah, that's actually really high. Like, we need to we need to send you to somebody that's going to treat that. So it just continued to get higher and higher. And now he's on, different meds for that. So like we got to that point, and then we went back to his geneticist, and she's, like, no, hold up. We need to really, like, this is actually really dangerous for him if he potentially has VEDS as well. So she, is like, okay, like, I think we need to go ahead and test the kid too, And once she ended up seeing like all three of my kids, and, my two youngest, so Joseph, that is now 9, and then Nora, that is 6 now. She assessed them, and she's like, they're like hypermobile in a very unusual way, like, and like the veins, and like they definitely stand out to me. But like we're gonna test all 3 of your kids, and like they end up testing them, and then Joseph and Nora, my youngest, both were positive for the same variant that I have. So she went ahead and she's like, we're giving them the diagnosis. We're going to keep them safe as possible. They found a knowledgeable geneticist at Children's National, which worked out well for us because, my son, the number of the specials that he see, they're all at Children's. And, we've had really good experience there because they actually like take the time and like they read about things and like acknowledge before they even see us. So like that actually helps us a lot when they talk to each other. We don't really see that in the adult world as much, I guess, So they end up getting, they're at like the rare disease clinic at Children's, and, they both were given the VEDS diagnosis, and they actually, same thing too, she said, I'm happy to take, because it's a clinic, to take you as well, if you would like, way all 3 of you follow together and we keep you on the same schedule. And I'm like, I really trusted her. Like she, like, it's really shown that like she understands it and is definitely in the best interest of the kids. So like we're all together, the same doctors now. And, she also like, I'm giving you the diagnosis to keep you safe. And like when you go to the ER, this is your diagnosis, and that I'm going to give you, like, gave us all, like emergency letters to take to the ER. They're a phone call away for us to call ahead for us if need be, to like really a good resource for us.
That's so wonderful. How did that, what did it feel like when you were like, there's so much happening in such a short period of time, it feels like, and you're processing your own diagnosis, then followed by 2 of your children's diagnoses. Like, what did that feel like for you?
I mean, it's just different points where like, I guess it's harder than others. Like sometimes you're just trying to survive and like just get through it, and it's like, you're trying so hard to keep it together. And especially like in front of the kids, you try to keep it together. And then like, you're really falling apart inside. It's like, I always think of that, like saying like, oh gosh, you see all posts on Facebook all the time and different things, like be kind, because you never know if the person next to you is trying everything to hold it together. You know what I mean? And I always think of myself like out and like barely holding it together. At one point I had seen a therapist, because it had gotten pretty tough, and that like, and she's like, this is like PTSD that from like these different medical things that have happened to you, and that like, and it was hard. Like I honestly, I couldn't even like really tell my story before because like, I couldn't stop the tears flowing, or, it really just kind of envelops you so much, and I think knowing with my kids their diagnosis, it actually helped because it gave us like a sense of control, and it gave a sense of like, okay, now we know and now we deal with it. Like the not knowing and not sure and kind of living in like a wishy-washy world, was, that was probably the hardest place for me to be. Because again, you just kind of like keep staring at your kids thinking like, do they have it? Do they not have it? Like, oh, I think they do. And you just really don't know. You don't know if you're doing the right thing. But now, like, at least I feel like we can make like the best educated guess. Even if like we don't have all the answers, I feel like we can at least try, I I mean, it's still hard because it definitely did change my kids' lives, like we keep getting all the invites for the trampoline park. It's like the place everybody invites the kids to go to the birthday parties, It's like a big fat no way, not happening for us,
Yeah.
And it's tough because then like, and I don't think it's hard because like nobody really understands, is that like what you've been through and like, it's just the things that like you just don't, you worry about or like these big worries, and it's kind of, it's tough,
For sure.
Yeah. And just trying to like figure it out as we go along, it's like, so if you don't really have a lot of answers and things like that, and, and it's like, what does the future look like for my kids,
Right.
and like, should I be really worried? Should I not, should I be a little less worried? It's hard. It's a lot of worrying. I'm a worrier already sort of by, nature. So it's not really a good mix.
Yeah. So I know that like having a VUS is a difficult area to be because, there's some people with VUSs that are not treated as if they have vascular EDS. And there's some people like you who have this like extensive medical history and, it just like fits all the pieces. And what do you do with that? Like you have this vascular EDS diagnosis, but you have a VUS. And so what has like the support been like? Have you met other people with VUSs? Have you met other people with VEDS? Like, what has that been like for you?
Honestly, like, I really like, it's just trying to figure out where we fit in it all. Is that like, we don't really fit in, any specific spot, is that like, I feel like even though like I was giving the VEDS diagnosis, I don't think it's fully acknowledged by like other people with VEDS always is that, I kind of met that a little bit is that like, oh, nope, you don't really have the diagnosis, even though like we're being treated such and like we have the background. And I feel like I have a lot of questions. I feel like that I can learn a lot more from people with VEDS than I can from go to the doctors, is that like, if I have a question about the kids and I constantly have questions about the kids and whether I'm doing the right things. And like, I just feel like there's nowhere for me to ask those questions. And, we obviously do have like a good system of doctors now set up for the kids and different specialists and everything like that. And I feel really happy with that. It's just more like the little things that come up that like, it's just nice to run by somebody who might understand it better,
Yeah, that is so challenging. And I think that we have more to do in that area for sure. Like, I think that people, I really feel for people in your situation where there is this kind of boundary between like the vascular EDS group and the VUS group essentially. And how do we bridge that? I think it's a really important challenge that we need to address. And I'm very, very grateful for you coming onto the show to share your story because I think understanding is important. And you had so many different, with the uterine rupture and the vertebral dissection and your history growing up and, it just, to me, I'm kind of with your geneticist, right? Like it makes sense. And where do you go and where do you belong? I think it's a really good issue to raise and address. And I'm thankful for you for sharing that.
Oh, thank you.
Yeah.
Yeah. So I feel like honestly, like there's a lot of like, there's not a lot of information and data. And I feel like my family adds to it and like I can learn, it's like if you like look at the bigger picture of everything together, like it gives us more data and like what to do and how to proceed and, exactly. So it's other people like me as well that like, we're just kind of out there dangling, until we get classified one or the other and, and like it's just waiting, but we still have the same problems, that others have too. So
yeah, that's such a good point. So you mentioned research. Are you part of research studies? Did you find research studies that VUSs are included in? And what are kind of like your hopes for the future with that?
Yeah, I look at that, I do always too. I always look at my own, variant too, to see if making any progress, along the way. And I do like look at research studies and things like that, especially for my kids. Cause like I'm medical too, and I want to like try to do anything. Also as like a mom, you want to try to like find anything that's going to help your kids. Cause right now, like you are still so powerless, so things you can help with or control, you try to find, like looking at research and things like that. And honestly, I haven't found anything that includes us, so it's just tough because I know there's a medication one out there, that like other countries use this medication, and knowing that we're not even eligible to participate is tough. It's like how long will it be for it to be available to us to be able to use a medication if it is the right medication for to be on. So
yeah, that's such a good point. There is, just for people listening and for you, there's the VEDS Collaborative Natural History Study that I think is including people with VUSs now. I don't know if it did before, but anybody listening, there's information in the episode show notes on where to go for that. That's run out of Oregon Health Science University by Dr. Shireen Shalhoub. And there's several other studies. I don't know which of those include people with VUSs, but they're more like natural history study kind of things. Such a good point. And I think that point that you raised is also, I've heard that similar point about like wanting to participate in research and not being able to from people with a null variant for vascular EDS. And and that the reason for not including them is much different for the reason for not including people with VUSs in those kind of trial like studies. And it's just, it's important to hear and figure out, that we have so much research to do in vascular EDS, and that includes for the VUSs as well.
Yeah.
Do you have advice for somebody else that has been through what you've been through and are going through?
I think it's like you just don't give up on getting the answers. Like, as many times I kind of backed down and I didn't like push it a little bit, that maybe I could have pushed it a little harder, and that like I felt strongly about testing my kids, but then like I let somebody kind of talk me out of it for, not for long, but like, I went a few months before we like decided to go ahead with the testing, knowing that that's like the right thing to do in my own research. And like, I think it's so important just to like really read and like learn about yourself, because, as you go in to see these different doctors, and that like you end up knowing more than they do a lot of times about like, realistically, unless they're the actual experts, of course. I mean, that's different. But like some of the specialists you go to see, like you really end up knowing more about, your disorder than they do. And like you need to kind of push a little bit to get your answers.
Yeah. I am curious, what kind of doctor did you see first at Johns Hopkins that was like, no, probably not?
It was a complex care specialist that also treats EDS.
Okay. I've never heard of that.
Yeah. And I guess I got grouped into like the EDS, like all of, what I mean? Which, I think about like the question you asked about, the VEDS community not accepting the variant of no significance community, as much. And like, I kind of get it, because then there's also like the same thing, how we get grouped in with like just general EDS and like, or just the presumption that it's all one big disorder, when like, obviously it's not, so I get it,
Yeah. I'd like to echo that. The, EDS is not one disorder. It's 13 or 14, depending on how, I can't remember if that 14th one is published or not, but there's rumors about a 14th type, and, it's not one condition, and they're all different from each other. And that further complicates the question of like, how do we build a community where people are able to get the answers to the questions that they have and connect with other people who are dealing with the same issues that they have, regardless of whether they have a VUS or a pathogenic variant. It's such I just like, there's not an easy answer to that, but there needs to be, there really needs to be, because it's got to be so lonely just out there.
Yeah, it definitely is, and like exactly. And then when you have you have kids, it like makes it even harder, you know, because it's like you're responsible for them too, and like not having something for them either, because then it's like, then where do they belong? Who, you know, how are they going to get support when they get older? Because like they don't fall in any group either. You know, it's,
Yeah.
It's like, it's hard, you know, and at this point, they're young enough. They don't understand it at all, where they're just going to the appointments. My kids are very used to going to medical appointments, you know, which is, you know, very used to getting blood draws, you know, unfortunately my son had to sit through an MRI a week, you know, and, you know, it's not normal life for them, but it's normal for them, I guess.
Well, you know, in all of your experience so far, do you have anything that you want medical professionals to know about what it's like living with the VUS or having vascular EDS?
I mean, it's definitely a couple things. Like one, I feel like they miss a lot of times the emotional aspect of it all too, is that like, I walked around definitely like traumatized from like these medical things that happened to me, you know, and that like nobody ever asked me if I was okay. You know, I was just like going from provider to provider, and like, they just like kept on like, oh, you want to breastfeed, and like, I'm going to make sure you breastfeed. Here's the meds. And like, and I honestly, at that point, I didn't care at all. And like, I thought the whole focus was on that. I'm like, oh my gosh, I'm going to die. My kids aren't going to know who their mom is. You know, they're so little, they're not going to remember me, you know? And like, I just couldn't get it out of my head. And like, I walked around like this, and I had nobody, you know, we had recently moved to this area, like, and I didn't have anybody around here, you know, and it was a really lonely place for a really long time. And like, nobody ever asked if I was okay, like emotionally. Like I got all the information thrown at me, and sometimes not the kindest way, but now I actually appreciate that they were so honest, you know, because at the time too, it's like, you want to know the information, you know, you want to know if it's serious, you want to know, but you also too, like, you're not okay always after like that information, like being told to get like your children's life insurance policies in order, you know, it's not something that like, it's an easy thing to hear or listen to or process, you know, and like, I never did process. We didn't do that, you know, which it's, you know, the things that bother you. There's definitely that. And definitely, for the medical providers, you know, it's okay if like, they aren't the expert, you know, like I think that you go in and they just kind of like expect, like they fake it, you know, and like, you can always tell, you know, like oh yes, I've seen it plenty of times. No, you didn't. Like, that's okay, you know, and, you know, you know, that it's also when they do the like, oh, they fill out the paperwork for school. Oh, they have EDS. Okay. That's not good enough. You know what I mean? Like, you know, yeah. And that like, make sure you read about the disorders and be okay with it. And, you know, and that like, if it's okay if the patients or their moms in front of you, like, know more about it than you are. I don't expect them to know anything, you know, and that's okay. You know, I expect you to look it up, you know, and that like, we work on this together and kind of like work through this all together, you know, and that's okay. I went back to the, OBGYN that, once I had the VEDS diagnosis too, I went back and I had seen her, you know, and, I was like, oh, look, you know, I just want to let you know that I got this disorder. And that, you know, like the things that happened to me, like would have fallen under, you know, that alerted that like I should have probably gotten tested sooner, you know, just, you know, and like you tell, like it just didn't even like register to her. Like that didn't, you know, that like like they could have even helped me somehow, you know, and that like, again, it was like, well, I see ADS patients all the time, you know, and, they offered me like a hysterectomy, and I'm like, I can't do that, you know, like that's actually dangerous for me now, you know, that, and, you know, it was, yeah, it's okay. It's okay to receive the information and like not pretend to be the expert. Like you don't have to be the expert on these rare diseases. Like my son has 2 different rare diseases, and like, I wouldn't expect you to ever heard of the 16p, you know, 11.2 deletion syndrome. Like it's just not a thing that you would have to know, you know, and that's okay. Like just work with me to like get him what he needs, or, you know.
Yeah.
But yeah.
That is such great information for the medical providers and medical students listening. And, you know, I hope that they really take that away from this. It's something that it's not the first time I've heard that advice to medical professionals. And I think that should make it even more like hit home like this repeatedly. You don't have to be the expert. You just have to be willing to work with us and look up the information and contact a provider that maybe knows a little bit more about it than you do, and be able to educate and learn. Such great advice for them. Thank you.
Thank you.
Is there anything else that you want the listeners to know about your story? Or what do you want people to take away from your story?
I just hope that it helps somebody, that my story can help, somebody somewhere, even if it's helping find the answers to what they're looking for, or, will help give them the courage to ask the questions, or, help the medical providers to kind of seek out more information, and really just help to kind of add the story to the VEDS community, and for the very no significance community that that we exist too, and that, we have a lot of the same struggles, and that we can kind of tell our stories and get them out there and help the bigger picture.
Yeah. Thank you so much for coming on and sharing your story. I really appreciate it.
Thank you. Thank you.
Thanks for listening to this episode featuring Nancy Billon, sharing her experience with a VUS for Vascular Ehlers-Danlos Syndrome. Next week, we'll talk to Melanie Case about her story with Marfan syndrome. If you're ready to meet others, get involved, or need support, there are links for you in the episode show notes, as well as information on research studies for people with VEDS, Marfan, and Loeys-Dietz, including those with a VUS. If you like this show, be sure to share it on social media or give it a rating or a review. You can also support the production of this podcast by joining my Patreon or by buying merch. As always, my top tier patrons are listed in the episode show notes. If you want to be on the next season of this show, there's a link in the episode show notes too to get on the pre-interview calendar. I'll be starting this process for next season in September. See you soon.